guys, so the first thing we're going to do is perform a mobilization with movement to increase plantar flexion on the right foot. Okay, so we're going to be doing a mobilization with movement to increase plantar flexion, and the first thing I'm going to do is assess the patient. So you go ahead and just flex your foot for me. And does that hurt?
Yes.
All right, and the motion is restricted, so this is the appropriate intervention for the patient. I'm going to start by placing the web space of my thumb over the anterior portion of the tibia and applying a posterior glide there, and that causes an anterior glide of the talus. I'm then going to ask the patient to go ahead and plantar flex the foot. Flex the foot again. Are you having pain with that?
No.
All right, good. And so I'm just going to apply a little bit of overpressure, okay?
Okay.
And does that hurt?
No.
All right, and we're going to come back to neutral, and then we're going to try it again. One more time. And does that hurt?
No, it feels better.
All right, and you're getting more motion there for sure. And then we're just going to go ahead and reassess that motion. So I want you to go ahead and flex your foot one more time towards the ground. And you have more motion, and is your pain a little bit better?
Better.
Awesome. So the dosing for that is going to be 3 sets of 10 reps, and we're going to assess for irritability before, during, and after the motion to ensure that the intervention is appropriate for the patient. So the next thing we're going to do is a Piriformis stretch on the right, and I'm going to choose to do a long sit Piriformis stretch on the right leg. For this exercise, I'm going to have the patient in a long sitting position like she is. I'm going to ask her to go ahead and take that right knee and bend it to move her heel back towards her bottom. And I'm going to ask her to take the left arm and then twist her torso over to get a good stretch of that Piriformis. And do you have any pain?
No.
Okay. And do you feel like you're getting a good stretch?
Yes.
All right. Thank you so much. The dosing for this would be to hold for 30 seconds and repeat 2 times. The patient can't get on the floor for the Piriformis stretch. Another thing that they could do would be to take their right leg and place it on top of their left, and then grab the opposite leg, and she's just going to lean forward, and that's going to get that good stretch of that Piriformis. Do you have any pain?
No.
So the next thing that we're going to do is a great toe extension, active assistive range of motion on the right foot. So I've decided to do an active assistive range of motion for great toe extension. The combination of the distraction with the active assistive range of motion in this exercise will help to improve great toe extension on that right foot. So before we get started, I just kind of want to see your foot move. So can you go ahead and just prop your foot up for me here? Mm-hmm. And can you just move that big toe? Let me see the motion.
Okay, that hurts.
You have pain?
Yes.
Okay, and do you feel like the motion's limited?
Yes.
All right. And I'm going to go ahead and sit next to you, if that's all right. Mm-hmm. I'm going to go ahead and have you take your right leg and prop it up on your left leg. We're going to take your right hand and stabilize just around the foot on those metatarsals. You're going to take the left hand and stabilize on that. It's called the first proximal phalanx. It's that first toe bone there. We're going to apply a slight distraction force, and you're going to point your toe back up towards your hand, and then come back down and point it back up towards your hand and come back down. And how are you feeling?
Fine.
You have any pain with that?
No.
Okay, so this is going to be to increase that great toe range of motion, okay? Go ahead and just reassess that motion. Can you move that big toe for me again? All right, thank you. So great toe extension is needed for a lot of functional activities, including gait. So this is a really important exercise to give to somebody who's struggling with that great toe extension. The dosing for this is going to be 3 sets of 10 reps, and I would assess after each one for the irritability to continue the exercise with the patient. So the next thing that we're going to do is a low-level strengthening exercise for the hamstrings on the right leg, and I've chosen to do an isometric muscle setting exercise for the hamstrings. I've chosen this because it's a good baseline exercise to give to a patient, maybe after a surgery or something like that, just to get the muscle activated and kind of reacquaint the patient with activating that muscle. So for this exercise, I'm going to have the patient supine with both of her legs extended, but because this is a low-level exercise, I'm going to go ahead and put this towel rolled up underneath of her right knee and just have her relax. And for the cueing for this patient, I'm going to ask her to press her heel into the couch or table in order to get a contraction in this muscle group here. So go ahead and try that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And I would assess for her irritability after each set to make sure that she was feeling good. And how are you feeling after that exercise?
Good.
And did you have any pain with that?
No.
All right, so we would go ahead and keep that as a part of her treatment program. For the dosing for the hamstring set, she's going to hold that about 10 seconds and repeat 10 times, and then we would assess for irritability to see if we would keep it in her treatment program. So the next thing that we're going to do is a high-level strengthening exercise for the hip adductors, and I'm going to choose to do a standing hip adductor exercise using a resistance band. So I've chosen to do this exercise because it's in standing, so it's a little bit more difficult. It adds a resistance piece, so it's going to challenge the adductors. All right, so what I'm going to do is I want you to hold on to this wall, and I'm going to hold on to this piece here. I want you to take this foot and cross it over the other foot, okay?
Okay.
And just go ahead whenever you're ready. Do you feel that?
Yes.
All right, thank you. And the dose for that is going to be 10 reps, 3 sets, and assess for irritability. So the last thing that we're going to do is demonstrate a proper squat. I'm going to make sure that my knees don't go over my toes. I'm going to make sure that my tibia and my torso are parallel to one another, and that I maintain external rotation and an abduction on my hips so they don't knock together. And it should look something like this. The squat is considered a functional exercise when the patient is cleared to bear weight on both extremities. You can start out using a mini squat, which isn't as intense, and then move towards a full squat in the late mod to max phase of treatment. It's good to simulate a functional activity, especially if the patient's returning to a high-level sport, but even just for simulating activities such as bending over or something that the patient may be attempting to accomplish in their daily life.